Hello everybody, this is Dr. Jung Ho Cha. Today we'll be talking about rhinoplasty.
The importance of balance.
Nose is located right in the center of the face, which is very important in giving the first impression of a person's appearance. A lot of people want to do rhinoplasties for multiple reasons, but we have to approach this very carefully so that this nose that particular client wants fits the facial profile. We need a balanced look.
Increasing the height of the nose.
We have a lot of people who are asking for the increase in height of the nose. In a lot of those cases, if you examine the nose carefully, it's not just the height, but it's more of the whole shape itself. A lot of those people have wide nose, so it's wide as well as less height. What we want to do is we want to narrow the nose as a whole and increase the height and projection at the same time. Of course, we do need to smooth out the surface from the front and also from the side as well. That is the baseline.
The balance of height and wideness.
Now, the reason that we need to narrow the nose and increase the height at the same time is because most people with flat and wide nose, if we leave that characteristic the way it is and just increase the height using any kind of materials, then it's not going to suit that person's face. If you think of a person with very tall status and a less than tall status, and then this person wants their height to increase, but then if we only increase the upper portion of their body, but their length of the lower portion stays the same, then there's a mismatch. It's the same thing with the nose portion. If we want to increase the height, we need to project the tip first so that it gets taller, not adding on the top here, but reconstructing the structures down here so that it looks naturally taller and more projected.
Is your nose really flat?
Also, there are a lot of people who want their nose bridge to be higher, but if we examine those people, it's not very low. But the reason that it looks very flat is because the nose itself is very wide. You can think of a mountain that's a shallow mountain and another mountain that's very steep. Steep mountain looks a lot higher than a shallow mountain. It's the same thing with the nose area there. So if you were to shave down on the sides to make it a little bit narrower, even with the same height and projection, it looks much higher. By doing that procedures, we are going to have a very natural looking and aesthetically pleasing nose.
Correcting naturally high noses.
For people with too high of a nose, very big hump and very drooping nose, in that case, we would need to reduce the height. But at the same time, if the tip is drooping a little bit too much, we want to raise that a little bit more to find the balance.
Correcting deviated noses.
A lot of people come to our place seeking for the correction of deviation of the nose. Now, we have to approach this from the whole facial profile and the nose itself to see exactly if it's just a nose problem or if it just looks curved because of the whole facial asymmetry. We're going to take all that into consideration, and then we're going to make it so that the nose follows exactly along the axes of the face. For deviations, it's not just confined to the outside appearance. The deviation starts from deep inside, which leads to the appearance of a crooked nose. So we're going to fix both the inside and outside to have the most optimal result. On the inside, the nasal septum probably would be deviated, which in turn leads to the tip being deviated towards one side. And then if you look from the sides, a lot of people have this hump and then a depression right underneath the bony portion, which leads to an irregularity in the bridge line here, and also a little bit different on the bony portion. So we're going to approach all of that in order to make a straight, nice looking nose. And because of those directional differences among each and every person and among the ethnic groups, we want to find the mid-ground that suits your face the best.
The process of a rhinoplasty.
The process for rhinoplasty, we can classify into the bridge area here and the tip portion here. So if we look at the model of the nose here, the bony portion is just up on the top area here, and then the cartilage portion starts from here downwards here. When we deal with the nose, we can both apply some procedures on the bony portion here and the cartilage portion at the same time. For the wide nasal bone people here, we want to reduce that by shaving the bone a little bit, and if it's necessary, we can also cut a little bit and then move the bone portion inward. And then we can also do some procedures on the tip portion. Now, when I say tip, it's not just the nose tip, but it's a combination of the columella, which is right in the middle between the nostrils here to the tip towards the nostrils all the way. So those are all combined, and the tip is very important. So whatever the procedures that we do, 95% of the effort is made on constructing the tip and straightening the inside as well.
Surgery on the tip of the nose.
So how I usually do the surgeries is that in most cases, we want to sharpen the tip a little bit and at the same time correct even the slightest deviation inside the nose would cause the tip to rotate a little towards one side or another. We want that tip to be right in the center, and in order to do that, we're going to straighten the nasal septum on the inside and also construct everything from the inside towards the outside. Sharpen it if it's necessary. And in some people, if it's too sharp, we can make it a little bit rounder. And also the projection angle from the side is also very important. Now, what we usually say is that in men, in relation to the axes of the face, the projection of the tip is best suited if it's between 90 to 95 degrees. In women, 95 to 100 degrees. So that's a little bit of a difference, but we want this optimal angle because we have to take into consideration each and every person's characteristic of the facial features. And once the tip is done, then we can also shave a little bit of the hump or the wide nasal bump to smooth out the surface.
Materials used for rhinoplasty.
The materials that I usually use for the tip is your own cartilage. It would be the septal cartilage on the inside. That would be my first choice. And then if it's not sufficient or if we need a little more for any kind of reasons, then we may use a little bit of the ear cartilage. In some restricted secondary cases, which we need a strong structural support, then we may use the rib cartilage, but I don't recommend that we use for the first timer.
Silicone implants.
We do use some foreign materials for rhinoplasty, so that would be the silicone implant. Now, silicone implant is solely used for increasing the height, adding volume purposes. So if we were to do the rhinoplasty here for the tip, we don't increase the tip projection by adding more volume, but we make it by reconstructing the shape here. But then in the bridge area here, we need to fill in that gap. And in order to do that, we would need to insert any kind of materials. But then I find that silicone implant is probably the safest and retains the shape the best. This is how the implant looks. So you can see that it's not a block, but it rather looks a little bit like a boat, and it's inserted like this. Now, these implants are designed so that it can be inserted all the way to the tip area here for people who just want to do the surgeries in simple ways, but I don't do that. We have to carve out the implant so that it best suits the underlying terrain of the nose. And of course, the tip portion will be reconstructed with your own cartilages on the inside. So the implant will be just confined to the bridge area alone where the nose is immovable, and the moving portion will be constructed with your own tissue.
Pain management during surgery.
For rhinoplasties, general anesthesia is not really required. It's surprisingly not very painful during the surgery. How this is usually done is we administer local anesthetic injections to numb the pain symptom, and then we put you to mild sleeping. Now, there are some people here in Korea who don't want to go under, and they go through the rhinoplasty process under local anesthesia where they're awake, and it's perfectly fine and we can do it. But then I do recommend that we go through under a mild sedation because it's kind of scary, right? That's why we do it a little bit under mild sedation. And because of this, you don't need to be hospitalized after surgery. I recommend that you stay in the recovery room for at least an hour. Some people want to leave much earlier than that, but I recommend that people stay here for at least an hour for them to completely wake up before going home.
After surgery treatment and recovery.
Now, after rhinoplasty, what you're going to expect is that we're going to have a splint over the top of the nose, packings inside the nose, and the stitches on the incision site. Usually the day after surgery, we do a little bit of a checkup and see how it goes, how the wounds are, and then we give the prophylactic antibiotics to prevent infections. And then the packings usually goes away 3 to 4 days after surgery, depending on the degree of the surgeries we did and then the bleeding tendency of each and every person. And then 1 week after the procedures, we're going to have the splint and stitches removed. There are going to be some absorbable stitches on the inside, which is not required to be removed. So basically speaking, in about a week, most of the treatment itself is over. Now, after the surgeries, you're not a patient, so you're just the person who receives the treatments in the nose area. So you don't need to stay indoors all the time. And I actually recommend that you stay active. And a lot of people who receive surgeries here go for sightseeing, do shopping, and then they come in, they recover super fast. Active people recover much faster than those who stay indoors all the time.
Healing period.
The most vital period that I think would be the first 1 week. Every surgery takes at least 6 months for it to completely settle down. Even a scratch takes at least 6 months for it to settle down. Now that's because of the nature of scar maturation, wound healing. But again, it doesn't necessarily mean that you have to be absolutely still for 6 months. I'm just merely saying that it takes 6 months for it to reach the final result. Any kind of surgeries, should anything goes wrong, it usually goes wrong within a week. And those going wrong within a week usually involve some kind of like a stitch, reopening or things like that. And if we fix those within a week, it's gonna be fine. And for that reason, I recommend that you stay here in Korea for at least a week so that you can do more follow-up and then remove the stitches. Now, of course, it's not required, and a lot of people actually take a flight even on the day of the surgeries, and then they have their stitches removed there. But I would feel much safer if you do the stitch removal here so that I can see how it goes. And after the treatment is over, then we're free to go.